she came on first, and Sebastian was tardy. And so Amy, go ahead and tell us a little bit about yourself and what you're doing at your site.
Hi, so I'm Amy. I'm currently in the CMAR Bellevue Clinic, and I graduated from college with a double major in biology and global health. And part of the reason I chose AmeriCorps is just being able to be in a clinic volunteering for a whole year, which is different than other experiences I'd had where I was just in the clinic maybe like once or twice a week and just getting to know patients and being able to see them over the course of a year. And in terms of my day-to-day, I help with our cancer screening programs, helping patients get scheduled for those, and then helping pull their results and walking them through all their appointment times, and then also helping out with other front desk and back desk needs around the clinic as we need them. And I've really enjoyed my year so far this year, just being able to work with everyone in the clinic and seeing everyone's goals and just being able to be an additional resource for patients sometimes when they have questions and just aren't sure what to do about their appointments.
Thank you, Amy. All right, Sebastian, you could tell us a little bit about yourself and what you're doing.
For sure. My name is Sebastian Perez. Sebastian Perez, either way works with me. I just graduated from Western Washington University. This is on, when did I graduate? Yeah, like last weekend, actually. I am a human services major and a economics minor. I used this as we had a internship requirement at my school for my program. So I use this as my 2 quarters of internship. But I'm saying just kind of using it as a job, just in general, completing all the hours. Yeah, patient navigator here in Bellingham at the Bellingham Clinic. A lot of my responsibilities are with translating in various different departments. I speak Spanish, so I've helped out our customer service representatives and help patients get insurances lined up, as well as just translating during appointments. There's a few other programs that I've helped out with. I've gotten certified with IPACs to do pictures for diabetic retinopathies. And then I've also helped out with the Food Farmacia, the food pantry program that we have here at the clinic, as well as our Reach Out and Read program as one of their representatives. And on Wednesdays, I help out with at base camp. We have here in Bellingham, we have the homeless shelter. So on Wednesdays, we have like a drop-in center that we set up at the clinic or at the shelter with one of our providers. And on Wednesdays, I'll go out and help out with that as well. Just kind of doing front desk work, getting appointments set up for them, just for patients there, and get their follow-up scheduled, as well as like any referrals or anything like that that need to be done. As far as my day-to-day goes, a majority of my day is spent working with interpreting, as well as working with, we've been doing a financial screening audit. So I've been helping out our front desk team and admin with that audit. And yeah, translating as well. That's the big portion of what I'm doing, and with like a few like other responsibilities just kind of scattered throughout the week, where there'll be certain days where I'll be doing certain other things.
Awesome. And Amy, correct me if I'm wrong, you've done some translating. You don't speak Spanish, but you speak Mandarin. You've done some translating there at Bellevue as well, correct?
Yes. And it's just been nice to be that like one person in the clinic. We have that happen a lot sometimes too, where other staff members will speak Dari or other languages, and it's just really nice. We do have pretty good interpreter services over the phone and video, but it's just nice to have that face-to-face interaction with someone who speaks your language.
Absolutely. And so, Georgina, I know you speak Spanish, so
yes, I do.
Bilingual skills will always be highly valued at CMAR, that's for sure. So
yes.
All right, so yes. I'll let you, Georgina, go ahead. Please feel free to ask questions of either or both of our patient health navigators.
Well, I don't got no questions. Everything sounds very good.
Okay, well, I've got a couple questions. Go for both of you. So Sebastian, I'll have you go first on this one. training. So when you first came on to CMAR, it's different than the doula, which we have a specific training for the doula. But what kind of site training did you get there? And then in addition, what kind of support did you get from CMAR staff when you came across duties or things that you didn't really know what to do or how to handle? And then we'll give it to Amy. Same question to Amy.
So I started off just screening. We're still doing COVID screenings at the time. So I'd say about for the first month, I was doing just COVID screenings at the front of the desk, or just as soon as people were coming in. So that training was like the first day or two I had like shadowed someone out there. And then after that, just kind of on my own. During that first week too, they sent me to do front desk training down in Linwood. They have different locations that you can do it at too, though. After that, I started doing translating. That they had me shadow kind of a little bit throughout. They had paired me with providers that speak Spanish. I already speak Spanish too, but it's just kind of getting those like solid vocabulary down that I needed a little more training on. That definitely helped out tons and tons, as well as for IPACS training. A lot of the trainings were done in groups. So like if you had any questions, you could always go to your head admin who is teaching you all these skills, or you could also just talk to your peers that were doing the training along with you. I don't think I had a training where I had to do it alone or anything like that. So it was really helpful to have those other team members as well, just kind of doing the same thing, going through trainings and having me do them.
Awesome. Amy?
My first couple weeks were kind of the same as Sebastian. I started out also doing front desk training, just generally getting to know what the clinic has. So Bellevue is a smaller clinic, so we don't have maternity support services and some of the other things that some of the other clinics have. So just kind of getting to know our clinic, since we do have fewer providers, just being familiar with the scope of what our clinic does, and then helping patients. Eventually, I got training on doing referrals and then helping with the cancer screenings, especially for patients that end up having referrals to other hospitals, just working with the MA supervisor, getting trained on understanding how that process works so that I can help explain it to patients. So everyone has been really helpful so far, all of my coworkers, with the whole process.
Awesome. And then through AmeriCorps, there's additional trainings. And in fact, both Amy and Sebastian and the birthday of Laura, they went to, it was a BASTA training, I think it was called. And you guys are in violation. You're not wearing the cool, they earn jackets. They earn these nice, oh, there we go. These nice Patagonia jackets from going to that training. So, so that was a nice little addition that they were able to earn. So there was, so it sounds like then CMAR style. There they go. You don't have to put it on now, but that's cool.
It's a little chilly out. It's a little chilly in the office.
So it sounds like then you were well supported at your clinic sites. I know one of the things, Georgina, am I pronouncing that right, Georgina?
Yes, you are.
I know one of the things AmeriCorps always encourages, and the fact I think that they didn't have an AmeriCorps director for a few months, is if you see a need at a clinic, you can maybe start your own project and say, hey, I see this. I think we need to get this information out in Spanish, or I can help with blood drives, or I can help with community things. We encourage that. We want you to feel like you know, you have some input there and can make some change if you see some things. There might be a program there that has never been run except for AmeriCorps people, and so that might be something new. So there's always different possibilities with every different site. So I think that's important to know, and that when going into, if we get to the interview process, you know, be sure that you ask that site director, hey, what are some needs you guys have there? You know, find out about their demographics and what they see coming through their door. Because I know with Amy, you have dental and behavioral health upstairs at the Bellevue Clinic, correct?
Yes.
And Sebastian, yours is just a straight clinic?
We have a dental, MSS. We also have like healthy homes. We have a few different departments at the clinic for sure.
And then Bellingham, I know, has another clinic. Amy, I know for MSS, you might refer them to the Seattle clinic, things like that. So so you'll learn more about within CMAR what other services are available. And Sebastian, were you able to take time to find out what other community resources are around you guys to refer to?
I do have a compiled list. It's actually fairly long. I don't have it on this computer is the one thing.
That's fine. That's fine. But you were able to
but
kind of get
yes,
something together.
Yeah, I do have something compiled just with all the different resources, just all of Whatcom County. So that goes from like housing resources to food resources, just a bunch of different, even for like, and it's split up in between like different age groups from like people in elementary school, middle school, high school, college, and then like adults and like elderly. So I have it split up amongst all those.
Awesome. Amy, were you able to find out resources in Bellevue?
Yeah, so we do end up having to refer patients out quite a bit because we don't have MSS or some of the other services, but our CSR customer service representative and our care coordinators are both really familiar with our community resources. So I worked a lot with them and just getting to know the options in Bellevue and when we need to refer out to other CMARs. And it's definitely a very cooperative process of like working with other clinics and everyone else in the clinic.
And then in addition to, them being trained on site, they have the ability to, go to other trainings where they got their cool jackets. I found out that we can offer language training, and we want to do more training that offers certification. I believe is it the community health worker, Sebastian? Yeah, to help people get that one, or the doula training, or I know we had talked about translator credentials and things like that. So we encourage AmeriCorps members to look for those, and the budget has money to help pay for that. So, and then those training hours count towards your service hours. So if you're taking additional training at night or something like that, those would count towards your 1,700 service hours. So it all comes together. So we're always encouraging AmeriCorps members to seek those out, and we'll try to help in any way that we can set that up. So any questions yet, Georgina?
Nope.
No?
Everything
Okay.
sounds very good.
Okay.
Sounds very good.
Awesome. Real quick then, since Amy and Sebastian, was there ever time you guys felt like overwhelmed in your position? Like, whoa, I'm in way over my head, and not sure what I can do here, or have you felt like always supported by CMAR?
I would say there's always someone that I could go to if there's like any issues. There are times I'd say the overwhelming, or when I do feel overwhelmed, is more so just like getting all these tasks from a day and just like having to complete those tasks in that day. But also there's someone that you can like kind of lean on or just let know what's going on, and they'll just manage just getting you extra help in completing those tasks for sure.
Amy?
Yeah, I think definitely being able to lean on front desk supervisor and our medical assistant supervisor, that if I ever really have any questions or I'm really stuck with something, they're always a source of guidance. And sometimes that we do have a pretty high patient volume, that sometimes the clinic may be understaffed, but it's a very strong camaraderie spirit that everyone's just working together on everything. So I've really liked working in our clinic.
All right. And then something that I'm a big proponent of with every staff I have, anytime you're working with people and you care and you're good at your job, you can take that home sometimes. It can be very stressful. So I want to take the time to talk about a little self-care and how that's maybe helped you kind of go through a whole year commitment. Because there's one thing, oh yeah, I'll volunteer once a week at the community center or something like that. But this is a volunteer job, basically. I mean, because you're going in every day, but at the same time, you're not being paid what everybody else around you is being paid. And so you have to know that and understand that, well, but I'm getting these other things in addition, and you know that you're signing up for service. So how was your personal self-care beneficial to you guys making it through the year? We'll start with you, Amy.
So for me, one of the things was definitely throughout the year so far, I've definitely picked up more duties as I've been more familiar with the clinic, but kind of just setting boundaries about, okay, I'm willing to help out with this, but taking on too many things might be too much for me. So knowing how to work out that balance of trying to help out in the clinic, because we always want to help more, but we only have 40 hours in a week to do our work. So definitely setting boundaries and how much other stuff I'm willing to take on has been really helpful. And just everyone in the clinic, in terms of my coworkers, have all been super nice and understanding in terms of we're all working together in a community setting with patients who might not have as many resources. So there's a lot more work in terms of we don't have a social worker in our clinic, so definitely working with our care coordinator and everyone else, there's a lot more that goes in terms of patient education throughout a patient's appointment and just making sure they're aware of what's happening. So it's very much a teamwork process.
Sebastian.
Sweet. And yeah, I would say same thing as Amy. Just kind of like the camaraderie around just everything at the clinic has definitely made it a lot easier to navigate all these situations. I would say that also setting boundaries as well. The clinic was really respectful as to recognizing that I was still a student as well. So it was just kind of letting them know the situation, what was going on. So even if I had like a final or something on like a Friday, I could let them know like, hey, I have this final, like this is what I can do in the week. Just kind of setting those boundaries, just letting them be in the loop, just helped out a lot in scheduling, getting everything done in the set work week. I never really had any situations where I had to really worry about getting a time off or getting whatever I needed done.
Awesome. And I just want to add to that, that if there was a situation where they needed to make a change or something wasn't working, they're not left hanging and having to work out with the site supervisor by themselves. They would contact me, we would talk, and then we would all meet with the site supervisor if we needed to try to find out a better solution to whatever's not working. And so it's not like we would just place you in someplace and say, okay, Georgina, good luck, hope it works out. No, we'd be checking in. I make site visits. We will have meetings. These guys, Sebastian and Amy, I think, recommended having some meetings periodically with all the patient health navigators to kind of find out what's going on, everybody touch base, and make sure things are going well, and maybe get some ideas for training. So,
Okay.
okay. Any questions yet? Nothing, anything pop in?
No.
Okay.
Everything looks good, and I hear good questions of what they're saying and everything.
Fantastic. Okay. Well, then I'll just go over briefly then how we're going to make the selection process, because it's not a hiring process, because again, so next week I'm going to start making phone interviews. Hopefully, that's my plan. So that's why I want you to, if you're definitely interested, to please return that email so I have you on the list of people to call to start those phone interviews. And then from there, phase after that would be a virtual interview with that site supervisor, and ask you a few questions, and definitely have you ask some questions. If you have not been to that site yet, to the Tacoma 11th Street site, I just want to pop in and just check it out visually and see what it looks like, and see kind of how it runs. So
Yeah.
and then hopefully we'll have selections made early July, so then we can begin the long process of the background checks and all the paperwork that needs to be done for a federal program. And then CMAR has, as Amy and Sebastian know, there's a lot of paperwork just for the CMAR side as well. So.
Okay.
Does that sound good?
Yeah.
Awesome. Well, I hope to get your email quick, because I'd love to talk to you more about it. And I know the Tacoma 11th Street site is definitely looking for somebody talented to help them out. So,
Okay.
Amy, Sebastian, you got anything else to add? Was it a good experience for you? Worthwhile?
I would say it was a great experience. Definitely learned a lot at the clinic and got a lot of experience, different certifications. I'm glad I got to get my hands on for sure. And it's definitely a hands-on job.
I've definitely enjoyed this year just seeing how unique CMAR is as an organization in the community, just being such a wide network of clinics and how the experience is different from having a doctor at a hospital and just seeing why patients might choose CMR over another place.
Awesome. All right. Well, thank you so much. Excuse me. Drank down the wrong tube earlier and I haven't been able to get rid of that little cough there. So, okay, well, Georgina, if you don't have any further questions, if something does come up and you have a question, feel free to email me and I can forward that to Amy and Sebastian and get answers for you. Okay.
Okay.
So thank you all for coming. I'm going to turn off the recording now. And Georgina, I hope to see you in the future very soon. And Amy and
Yes.
Sebastian, today's Laura's last day. I saw Laura's the third person I saw Laura today. Give her a big hug. We're going to miss her. So, all right. Well, you all take care. Thank you very much.
Thank you.
Enjoy the rest of your day.
Thank you.
Bye.
Bye.
Nice to meet you
Bye-bye.
as well.
You
Bye.
thank you. Bye.